Tara Sundem. I'm the executive director and founder of Hushabye Nursery.
What inspired you to create the organization?
I am a neonatal nurse practitioner by training, and I worked in the neonatal intensive care units for it was about 20 years when we started to see more babies coming into our NICUs withdrawing and being exposed to opiates. And um, it's really hard to watch a baby withdraw. One mom explained to me withdrawal is the worst flu and migraine times 100. And when she dumbed that down for me, I was like, oh my gosh, that is what we see with babies: vomiting, diarrhea, tummy aches, irritability, can't sleep, hypersensitive to everything. And when she dumbed that down, I thought of like, okay, when I have the flu or COVID, let's say, most recently, and I mean, I went in my room, I made it completely dark. I had the fan on and I got chills and, hot and cold and hot. And in the neonatal intensive care unit, we put a baby that's experiencing those same symptoms in bright lights, beeping monitors, in an environment that was created for babies that are truly fighting for their lives. And it's created for a reason. But with the opioid crisis starting in 2010, in 2015, seeing this influx of these babies coming in, I just was like, my goodness, we can do better. And if it were my baby, I would demand better. And so that's where it started. Just going, we can do a better job. And, as nurses, ethically, we say that we're advocating for our clients. And that truly is Hushabye, advocating for moms, dads, babies to get well in a non-judgmental, stigma-free environment.
Yeah, can you tell me about the organization?
Yeah, yeah. So we are a nonprofit that serves pregnant and parenting families that are impacted by the opioid crisis. So a mom finds out she's pregnant, or a dad finds out that they're expecting a baby, and they either have a history of opiate use disorder, addiction to opiates, or they're struggling currently, and they're scared to death. They, number one, love their baby. Number two, they want to raise their baby. Number three, they're very, very hopeless. And number four, don't know what to do. And so somehow they get connected with us. If that's through an obstetrician, word of mouth is huge. Recovery centers, a lot of methadone or Suboxone clinics, providers, work with us and they partner with us and they're like, reach out. And so we offer anywhere from 50 to 60 groups a month, depending on the month. Anywhere from how do you swaddle your baby? How do you put a diaper on? Are you ready for recovery? What is anger management? Triple P parenting, all of the things to help our families succeed in ensuring that they're able to raise their babies safely by getting well, by having the resources that they can, working with Department of Child Safety or Child Welfare to ensure that their baby is safe. That is what we do prenatally, postpartum. We have a 12-bed nursery after baby's born that hopefully at 24 hours of age, before the baby has escalated to really struggling with withdrawals, baby and mom are transferred to Hushabye Nursery, where we have private rooms where moms and dads can stay with their babies, going through that withdrawal process. We have one-to-one caregivers that are able to hold baby 24/7 when that mom needs to sleep, when that mom needs to go to a recovery group, whatever that family system needs, we're there to ensure that their baby has what their baby needs 24/7. What we've been able to do is, number one, decrease the time that it takes to get through that withdrawal process. So imagine worst flu and migraine times 100. If I told you that you could get through it in 22 days or you can get through it in 8 days, we would pick 8.
Right. Yeah.
Hushabye is able to get babies through that acute withdrawal process by 8 days. In the neonatal intensive care unit, it's an average of 22 days. New study that we just read said 18 days. So they're getting better in the neonatal intensive care unit, but still 1 day of being able to make a baby feel better, get rid of those symptoms is absolutely worth it.
And you're seeing these babies struggle. What is it like containing your own emotions for the focus of the baby?
Yeah. Yeah, that is one of the that my example to this would be when we were trying to figure out if we were going to start Hushabye or not. We had a thought, but didn't know what that was going to look like, and honestly didn't know how to do it as, a nurse. And had one night a baby that was having a really hard time, and the dad had told me before he had left that night that he wasn't going to go home. And I was like, why? Please go home. There's no place for you to sleep. We'll take care of your baby and then come back in the morning. But you're not doing your baby any good if you're sleep deprived and
Right.
anxious. And I promised him that I would call him if his baby was having a hard time. And he goes, well, you're going to end up calling me. I can guarantee it. And what he meant was, between 2 and 5 in the morning, he started to see a trend that his baby got prescribed more morphine at the hospital in the middle of the night, um, at that time. And he was frustrated. He's like, we're never going to go home if this continues. And so he, in his head, thought, you know what, if I stay, I can keep my baby from escalating and hopefully we'll get through this withdrawal process sooner. And so I promised him that I would call him if that occurred. And 2:30 in the morning, right on the dot, get a call from the nurse that baby is screaming. I go in, this baby has beads of sweat on his face. For a baby to cry, a newborn to cry that much, that baby can cry for a long time. The nurse immediately said, you need to give this baby morphine. And I said, well, yeah, but we promised dad that we are going to call him. So you need to call him, tell him to get in here. He promised me he'd get to us within 30 minutes. And the energy in the room was not good. The nurse was, had it. Um, Babies are crying all over. And I just was like, oh my gosh, this baby is arching, stiff as a board, screaming. I could not get him settled. And I'm like, oh my goodness, the worst thing that can happen with withdrawals for a baby is they have a seizure. Um, as a provider, I told this dad that I wasn't going to give the baby morphine, but I could not get the baby settled. And I'm like, okay, you promised. So I took baby, I broke the rules, took baby into my call room, made it completely dark. So just across the room, literally, it is maybe as big as a closet. Made it completely dark. And I can feel myself just anxious. I'm trying to get this baby settled. And when you can't get a baby settled and they're just screaming, it's not a good feeling.
Mm.
And I ended up realizing that my energy was not making it any better. And so at the time, I'd been practicing yoga for a long time. And I'm like, okay, get yourself together, do a deep breath, hold your breath, and let it out. And what I found was when I did that, all of a sudden, baby paused in their crying. Like he was like, what just happened? I was like, oh, okay, maybe this is onto something. I did it
So,
2 more times, and each time interrupted his crying with each deep breath and holding it. And I was like, oh my goodness. As I did that, I felt myself relax. So I was like, oh my goodness, okay. Well, as I'm settling him and I'm doing these bouncing motions, but as I'm doing these bouncing motions, I'm getting myself together. I'm able to like think about how do I get this baby settled. Um, I can feel baby, and baby's cry is baby's still crying, but not to the extent. And you can feel baby starting to relax. And as I'm doing that, still doing the squatting motion, holding baby tight, I started doing this shushing noise, which is to mimic mom's heartbeat. And I had read about it, and I'm like, okay, let me just try. And as I'm doing that, I'm doing the shh, 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 and doing the bouncing moment. Every now and then I would stop and take a couple deep breaths, and all of a sudden baby stops crying. A little bit later, I get a knock on the door, and when dad opened the door, baby was asleep. And he's looking at me, and I'm like, oh, please. And he goes, to be in the NICU? And I'm like, perfect. I will let you know. And that baby slept for 3 hours
Wow.
completely. So seeing that one time, then it just kind of progressed. I was like, okay, the next time another nurse wanted me to give a dose of morphine, I'm like, no, I literally at another NICU took the baby into a closet and I was like, let me see if I can get him settled. And I was able to get him settled and did not have to give morphine. Not that I wouldn't give morphine, but I didn't have to. And knowing that babies feed off our energy is huge. And we see that even at Hushabye. Some nights, some days are hard, and we have to give our caregivers, if that's mom, dad, if that's our nurses, our patient care assistants, our volunteers, if we need to tap out, you have to tap out and get someone in there with better energy that can take those deep breaths, that baby feels calm and secure. And that is the environment that Hushabye has been able to prove makes a difference. We will have a baby transferred to us frantic. And within 30 minutes, maybe an hour at the max, you see that family and that baby de-escalate. They come in just coming in hot, just very triggered and escalated. And coming in and us saying to parent number one, congratulations. They're like, did you seriously just say congratulations? And us telling them that their baby is beautiful and that they did a good job. De-escalates mom and dad, which then that radiates to baby. And within an hour, you see that baby many times catching flies. Like instead of that crying, they're on mom's chest with their mouth open, just finally able to give in and relax. And that's the environment that these babies, number one, deserve and what has been proven to heal. It is a care model that's not been done anywhere in the country. More and more places throughout the country are starting to adapt a similar care model, but this is a different lane for babies in healthcare that we never had to create before. And now we have to. And we are proving that eventually we're going to be considered the gold standard of care. That when a mom that has struggled with substance use and opiate is what her baby is exposed to, our care model that is medical and behavioral health coming together is going to be accepted. How long is it going to take? I don't know. We've been going for 4 years. It's still, it's hard to get all of the community partners on the same page. Sometimes those stars align and it just goes fabulously. And other times it's hard and it's a challenge and you go, how come people struggle? And it's because there's barriers to care and behavioral health, people with mental health and substance use issues, stigma, and other barriers to care are what keep them from getting healthy. And we see that every single day. What we've proven is with kindness and compassion, people heal.
Yeah, do you see the parents' confidence level rise as they get support from you?
Yeah, yeah. I have a mom that is 3 months postpartum, and when we met her, she had used fentanyl like within the hour before she delivered, and she came to Hushabye, and gosh, my team like embraced this mom. to see her every single day grow, going, you believe in me, you got me into treatment. We actually have like it's not a new program, but we have everyone in our team really ignited to help our breastfeeding program succeed. And everyone would say, you're letting a mom that's struggling with opiate use disorder breastfeed. Well, we get them well,
Yeah.
and it's proven that breast milk, I mean, we've proven it, that science says that breast milk is easier on the gut. And babies have tummy aches when they're withdrawing. And guess what? Babies do better with breast milk. So many people go, well, they're getting mom's medication that goes through the breast milk that makes it easier. The amount of medication that goes through the breast milk to babies is minuscule. The fact that breast milk is easier to digest is what's proven. When moms are able to, this mom came to us, we got her into treatment. She did not use. When she did her drug test that finally showed that there was nothing left in her system and that it was safe for her to breastfeed, you saw her, just the pride to know that she was the only one that can feed her baby, and that, look what I have done. And to have our team cheering her on, and supporting her is just something that I didn't see in the hospital. A couple weeks ago, she went to treatment after baby was discharged. Baby actually went into foster care because mom had been homeless. We had to prove that she was really going to be well. And she was reunified 2 weeks ago. Before that, the week before that, she sent me a picture, and the recovery center sent us a picture of her in front of a computer filling out an application for a job. The next picture was her working with a community partner called Trust for Success, where they take those that don't have the means to get interview outfits. They go and can shop for free. She's in a suit. She is ready for an interview to be a peer support specialist. That was not the mom that I met that transferred. This mom was smiling, excited, aglow, and to hear that her baby is succeeding and she's succeeding, working with Department of Child Safety, her other babies, she doesn't have custody of them. She was in a different place. And why? Substance use. This time she did not have the barriers that probably held her back with the previous pregnancies, previous babies. But she is well with this one and doing things that I would have said in the hospital that there's no way. And now I've learned to never, ever, ever say never, because I see families that come back and they just glow. You can tell when someone's struggling, at least I can. They kind of have a gray undertone, like just hopeless. Not a smile, just they're just not well. And when they come in, even a week after being at Hushabye, or they come in 3 months after getting well after treatment, you can tell when they walk in, the way they hold themselves, the confidence. To see them be proud of themselves is the greatest gift, to know that Hushabye's just had a little part in their journey is pretty cool.
And with your team, what is it like working with people who believe in your mission?
Oh, our team is is the best hearts that you could ever imagine. I sit there and go, okay, how did we get people that, number one, they want to care for babies?
Right.
That's the pull. But we really stress in the interview process and the onboarding process that our goal is healthy mom and dad, healthy baby, and as long as it's safe, family unification. And to see so many get it and actually understand how important the family system is. When I was a bedside nurse, I really thought that the best place for these babies was foster care. I did not think that sending these babies home with these families was a good idea by any means. Now, I believe that if you give the families the support and the resources, the best place for this baby is with their mom and dad. Yes, we have to make sure it's safe, but imagine being able to look at child welfare as a partner instead of a punishment. And that is what we help families understand, that Department of Child Safety wants to keep your baby safe.
Mm.
And I always tell families, your number one goal is you want a healthy baby. Number two, you want a safe baby. And number three, you want to be raising your baby. And when I say those things, they're like, oh, so Department of Child Safety is going to keep my baby safe? Okay, that's a good thing. And it's that partnership that we've been able to create and help break down those barriers and build support on both sides with parents and DCS. We help DCS do their job. We show them that, look, these are all the things that they've done. We connect them with the support team that they are going to encourage postpartum. We do it prenatally. It is a partnership that has proven to decrease the amount of babies going to foster care. If a family is connected with us prenatally, they start doing our groups, even one group, 79% of those families take their babies home. 79. In the hospital, less than 50%, but we are probably less than 25%. I do not have that data, but when I ask my coworkers anecdotally, what would you say? Many of them say 1 out of 4 go home with their parents. And so when you're looking at a complete inverting of outcomes, it works. Our program works, and it should be the standard of care. Yes, it has to be safe, but babies need their moms and dads. And if you ever were to talk to someone that's been in the foster care system and they're aging out, meaning, they hit 18, maybe 21 in some states, where are they going first? They're going to find their birth parents. They want to know them. They belong with their parents if we can get our parents healthy. Has to be safe, though.
You do a lot to help others, but what do you do to help your own mental health?
Oh, so well, I pray a lot. I mean, I'm a believer. So number one, always asking for guidance and the ability to lead and meet people with grace and compassion. I think that's the biggest. I ask for people to give that to me. So I really try to instill that, in my actions. So prayer, number one. Number two, taking those moments out and doing those deep breaths, taking walks. Nature helps, being outside. But we just created a hush and heal room at Hushabye. When I was trying to get Hushabye up and running, we initially had a first site that we thought Hushabye was going to be at, and it fell through. But we had a location figured out by the architects that was going to be the Zen room, the room that we asked our employees to take 15 to 20 minutes out of their day to go and just get back together. And the Zen room never happened because we ended up, the first location didn't work out. We ended up finding another location, but there wasn't a space. We didn't have enough room. And in the last 2 years, we built out the basement of our location for offices and administrative. And finally, at Christmas time, I had a space that was built out for this Zen room. we didn't have the funding. Told my family about it, and I was like, I really want this for our staff, but we don't have it. And my family came through with a lot of donations, but a massage chair for the family or for our team. We had like a donated rug that had never been used, a TV. Someone got a TV for Christmas, and I'm like, can I have that TV? Put Bob Ross on there and be able to, like just chill. There's rocking chairs in there and just dim lighting. But we encourage our staff to go sit in that massage chair and just get away. So it did not given to them for Christmas, but for Valentine's Day, it was their little gift of love from my family to them. And I have to say the first time that I was in the chair was last Friday. And oh yeah, it does the job. I was like, okay, you really need to set your alarm because you might fall asleep. But that's something that I think is going to be more valuable than what I even thought it was going to be. Because I got out of there going, okay, I feel better. Now let's go. So
Where do you want to see your mission in the next 3 to 5 years?
I would love to see it a couple sites, a couple additional sites, at least here in Arizona, northern Arizona, all over rural Arizona. They're truly deserts for medical and behavioral health care. I would love, love, love to be able to see our mission in our location be able to be expanded to those other organizations or to those other areas. Our Attorney General, Chris Mays, has that same vision. And so we're hoping that maybe we'll get a little support to be able to make that a reality. We really would need a hospital system in that community to be on board to really be a strong partner for us to be able to succeed. So it's going to take a lot, but I do think that is what our babies and our families deserve. Our community too.
How can people reach out and learn more?
Hushabyenursery.org. So www.hushabye nursery, nursery.org. You can absolutely go on there, watch the videos, learn a little bit about stigma. We have peer supports telling their story, moms and dads that have gotten support through us. Donations. We would love donations we have an Amazon wish list. Diapers are great always. But if your listeners do have the ability to help us, we would love, the donations. We fundraise for about $3 million every year, because that is what is not covered by, the payer reimbursement right now. It's a new model. It's something that, is never been done before. And so it's slowly but surely getting there, but promise every dollar will go to ensuring that every single baby has a chance at a healthy start.